The second medication that I have to take every day is... Let's not do that. Hey everybody, and welcome back to my channel. If you haven't seen any of my videos before, my name is Devin. I'm a graduate mental health counseling student, but I've also been dealing with mental health issues for my entire life. And on this channel, I try to combine those two perspectives to give a more well-rounded view of what mental illness actually looks like. If you're a returning viewer, thank you so much for coming back. You have no idea how much I appreciate it. Please make sure that you smash that like button and hit subscribe so that way you don't miss any of my future videos. In today's video, we're going to be talking all about all of the lovely medications that help to keep me alive. For those who are new to my channel, I was diagnosed with an autoimmune disease called ulcerative colitis when I was 18 years old. And for that, I have to take medications every day. But I also have to take medications for a few of the mental illnesses that I have been diagnosed with, which include anxiety, depression, and ADHD. Now, that can look like a lot of pills over the course of a day. Today, we're going to be going through each of my medications one by one. I'm going to be telling you what I use them for specifically, but also the general uses for them, in addition to how much these medications would cost if I didn't have insurance. The cost of prescription drugs in this country is ridiculous, and I haven't had health insurance multiple times in my life. So I wanted to show you guys how expensive it actually would be for me to be able to get all of the medications that I desperately need if I didn't have health insurance. And trust me, it's a lot. I'm not gonna lie to you guys, I actually really hate filling up this dang thing. I have put it off for so long. I honestly don't think I've filled it up in at least 5 or 6 months. Probably more than that, honestly. I don't know what it is. It's probably part of my ADHD, but I really hate sitting down and looking at all of the pills that I'm gonna have to take for the week. If I can only look at the ones that I have to take right at that time, it's a little less overwhelming. However, I also know that because I have ADHD, I have a hard time remembering to do things. So a pill organizer can really help with medication management and medication adherence. It's really important that I take all of my meds and that I take them on time. So while this is a helpful tool, I'm also really anxious about this right now, so just bear with me. I have to take meds 3 times a day. Not all of them take 3 times a day, but throughout the day, I have to take my medications 3 separate times. So I have this lovely pill case that has 7 days a week, and each day pops out and has 3 sections in it. So that way you can separate your morning, afternoon, and night meds. And it's really easy to look back and see if you've forgotten a dose, because I am terrible at that. Lately, Jake has gotten on me so many times because I look at him and say, "Have I taken my meds yet?" Like he knows. All right. We got them all out and ready. Now, the first medication we're going to be talking about is Imuran, or also known by its generic name, azathioprine. This medication is an immunosuppressant, and what it does is it suppresses your entire immune system. It's typically used for people with autoimmune diseases, or if somebody has had an organ transplant, they will be given this medication so that way their body does not reject the new organ that has been put in. These are each 50 milligram tablets, and I have to take 3 of these a day. So I take 150 milligrams of this a day. That's a little bit higher than a normal starting dose, but I have been on this medication for a few years now. So this, unfortunately, is a medication that as time goes on, you normally have to increase the dose on a little bit. Now, all medications have side effects, but those for Imuran can be a little more severe considering that you are dealing with somebody's immune system. You're messing with their main line of defense from the outside world. The more common side effects for this medication include unusual bleeding or bruising, unusual tiredness or weakness, and fever, nausea, and diarrhea, which is kind of weird considering I take this medication for an autoimmune disease that affects my digestive system. So those last 2 side effects on the list are already symptoms of my disease. In the US, there are a lot of discount programs for prescriptions for people who do not have health insurance. Now, to find the prices of all my medications, I went on to drug.com and on there they have a coupon, and those coupons are accepted at most pharmacies nationwide. So these are the prices that I would pay for 1 month's worth of my prescription if I didn't have health insurance and used the drug.com coupon. The price for Imuran, the name brand drug, is about $798. The generic azathioprine is available for about $105 for a 1 month supply. The second medication that I have to take every day is Apriso. This is another medication that I have to take for my ulcerative colitis. This medication is actually specifically for people with my autoimmune disease that are in remission. What it does is stop the production of certain chemicals in the lining of my colon that cause inflammation, which then cause pain and suffering. So for these, I call these my horse pills because I don't know if you can see, but they're pretty dang big, and they also sound like maracas. I get to take 4 of these a day. This is also another reason I don't like filling up my pill organizer. It's a puzzle every time because I have a lot of pills and giant pills. However, because a lot of these medications I only have to take once a day, I can try to spread out the pills throughout the day. So the Imuran and the Apriso I only take once a day, but I have to take multiple pills of each once a day. You can't get away from side effects with any of these medications. So side effects for Apriso can include hair loss, kidney and liver problems, which also can include possible kidney and liver failure, and then some of the more normal side effects like headache, nausea, and diarrhea, which again is kind of strange considering I take these medications to stop those last 2 side effects. For this medication, there's really only 1 dose that's accepted. You take 4 pills every morning and they're extended release. I believe they're 0.375 grams a piece. Yeah, 0.375 grams a piece. So each person for a 30-day supply would need 120 of these capsules. For Apriso, the name brand drug, the cost of 120 of those capsules, a 1 month supply, is about $542. The generic form of Apriso is mesalamine. I can't tell you if I pronounced that right. And the cost is $395 a month. Now the first 2 medications are the ones that I take for my chronic autoimmune condition, ulcerative colitis. The last 3 prescriptions I take for my different mental illnesses. The first one we're going to talk about is Cymbalta, which is the brand name. Duloxetine is the generic version, is a selective serotonin and norepinephrine reuptake inhibitor. Now I know that that's a lot of words, but essentially it just means that it takes the levels of serotonin and norepinephrine that are in your central nervous system, in your brain, and they causes those levels to go up. What that causes for the person taking the meds is anti-anxiety effects, antidepressant effects, and actually pain relieving effects all over the body. This is one of the reasons why my doctor put me on this medication, to actually try to help not only with my depression, but with my all over body pain that comes with my autoimmune disease. So I take 1 of these once a day, and it is 60 milligrams. It is an extended release capsule, so it doesn't necessarily matter when I take it, as long as I take it at the same time every day, which is the case with a lot of these medications. I have to make sure I take them at the same time every day to keep the levels in my body up. Doctors will prescribe Cymbalta for things such as major depressive disorder, generalized anxiety disorder, fibromyalgia, and even to treat the nerve pain that is associated with diabetes. The physical side effects include things like nausea, headaches, and dizziness, but it also includes some mental side effects. If a person is diagnosed with depression but actually has bipolar disorder and is given Cymbalta, it can cause a manic episode. Like most other antidepressants, it can also increase a person's suicidal thoughts and decrease their sex drive. I swear every day I simply juggle with dealing with the symptoms of my illnesses or dealing with the side effects of my medication. That's a balance that a lot of people don't have to think about, but when you take a lot of medications every day, you do have to think about these kinds of things. So this drug really does a lot for me. It's anti-anxiety, it's antidepressant, it helps with pain, but how much does it cost? For a 1 month supply of the name brand Cymbalta, it would cost me approximately $341. Now that would be 30 capsules at 60 milligrams a piece. The cost for the generic version is much more reasonable. If I were to get a 1 month supply of duloxetine, again, 30 capsules, 60 milligrams, the cost is only about $32 a month. So I use Cymbalta mostly for my depression, but I have another one for anxiety. It's called BusPar. BusPar was a name brand version of the drug buspirone, which is the generic version. During my research, I found that this drug was only available in a generic version now. So the only way that you can get this drug is if you get the generic buspirone. Now this drug is different than other anxiety drugs in the sense that it doesn't make you a zombie like people think of when they think of things such as Xanax. And it's also non-addictive. People aren't going to be trying to buy this on the street. This is a much more mild anti-anxiety drug than a lot of the ones that people already know about. But that's honestly the reason I chose it. I got put on this medication when I was in the psychiatric hospital, and I told them that I needed anxiety meds, but I wanted nothing that I could get addicted to. I have a very addictive personality and addiction runs in my family, so I didn't even want to run the risk. So this is the drug that they gave me because I told them nothing I can get dependent on, and I've been using it for years and it really works. So the doses for BusPar do vary based on the patient. I currently take 15 milligrams 3 times a day. So I have to take 15 milligrams in the morning, in the afternoon, and at night. And that allows the drug to be in my system at all times and just kind of mellow me out. Now you know this one's got side effects too. It includes things such as restlessness and trouble sleeping, numbness and tingling in the hands or in the feet, and chest and muscle pain. Now I guess it's good news that there is only a generic version, which means there is not a version of buspirone at the moment on the market that is ridiculously expensive. But if I were to want to buy a 30-day supply of this medication for myself, it would still cost me about $109. So I told you guys I'd probably be anxious, and I screwed up a little bit. When I was talking earlier about my Cymbalta prescription, I gave you all the correct information, but I actually showed you this one, which is the next medication we're going to be talking about, which is my ADHD med. This bottle is actually the bottle for my Cymbalta, and I have to take these once a day. So I'm going to put those out again real quick, and then we can move on to our last prescription. So the Cymbalta, it's anti-anxiety, antidepressant, and helps with pain. It's in this bottle. The one that's actually in this bottle that I showed you earlier is my Strattera. This also has a generic version that I can't really pronounce well, but it's called AUTOIMMUNE. We're gonna leave it at that. Strattera is considered a selective norepinephrine reuptake inhibitor. Now, that is similar to the type of medication that Cymbalta is, but Cymbalta increases the levels of both norepinephrine and serotonin, whereas Strattera only does norepinephrine. Now, this medication is thought to help out in areas of impulse control and hyperactivity, which is really good because it's given out to people for ADHD. When most people think of ADHD medications, they think of stimulants, Adderall, Ritalin, those types of medications. This is not in the same class of medication at all. It doesn't give me that jolt of energy or anything like that. It simply helps me deal with my hyperactivity and impulse control throughout the day, as opposed to getting like that super focus that I'm told that people get when they take those stimulant drugs. So for my Strattera, I have to take this twice a day, and it is 25 milligrams a piece. I have to take it right when I wake up and in the afternoon. This is not a drug that I should be taking right before bed because it will make it so that I cannot sleep. Strattera is actually the newest drug that I've started. I only got diagnosed with ADHD right back in April, so this is a brand new territory for me, and I didn't think that stimulants would be a good option. So I'm really glad that I found something that works for me, that doesn't have that stimulant addictive property to it, but it does help me get through my day because ADHD makes life hard. Side effects for Strattera include things such as joint pain, decreased sex drive, again, and nausea, vomiting, and stomach pain, which isn't fun when you have an autoimmune disease that affects your digestive system. It can be really frustrating when every medication you have to take, the symptoms of one of the diseases that you're trying to help ends up being on the side effects list. It's fresh. I don't know. Unfortunately, like I said before, once you have this many medications, you have to balance symptoms and side effects because that's the only way you're gonna have the best quality of life possible. Now for cost. Strattera, the brand name version for a 1 month supply, would cost me about $422. The generic version, which I'm not gonna try to pronounce again, would cost me about $130 for a 1 month supply. Some people would think that once I take my prescription medications, that I'm done. But unfortunately, that's not the case for me. I also have to take other pills in order to try to increase that quality of life like I was talking about before. First one is just a woman's vitamin. I take a vitamin once a day because I can't always eat all of the nutrients that I need. But not only that, I have scar tissue that is inside my digestive system. So even if I consume the nutrients, it doesn't necessarily mean that my body will absorb them. So it's really important for me to make sure that I get my vitamins in. The second over-the-counter supplement that I take is turmeric. And I know I'm probably pronouncing that wrong. I always do. Y'all can make fun of me if you want. So this is a spice. A lot of people make teas with it. I personally hate all tea in general. I'm very picky. It doesn't help. So I take one of these pills a day and it helps with overall inflammation in the body, which helps with pain. The last supplement I don't necessarily need to take every day, but because I'm doing my pill organizer, I'd like to have them in there just in case I do need them. Makes it easier. Melatonin. Now this is a very popular supplement that people take and it helps people get to sleep. The ones that we have are supposed to help us fall asleep and help us stay asleep. Now I can't say they necessarily work 100%, but I would rather have to take melatonin occasionally than try to take like a sleeping medication that I would have to take every single day for it to really work. And that's it, guys. All of my medications, all of the pills that I have to take in a day. It's a lot, I know, but I also know that I'm really lucky to live in an age where these medications are an option to me. Now, I say often that these medications keep me alive, and I honestly believe that to be true. No, if I stop taking my meds, I won't immediately just die. My autoimmune disease is not fatal. However, if left untreated, it could possibly become fatal. Same thing with mental illnesses. No, I'm not going to die immediately if I stop taking my antidepressant. However, I could become more suicidal, which could lead down a path I don't necessarily want to go down. So these medications, all of these medications are so important to me. They let me live my life in the most normal way possible. So as I told you earlier, I use drug.com to figure out different prescription prices. I did a little bit of math, it's on there, to show you guys how much it would cost for my meds if I were to buy them without insurance. And in this, I'm only talking about my prescriptions. I don't know how much my supplements cost off the top of my head. So if I were to buy all of my prescriptions name brand without insurance, besides the BusPar, because it doesn't come in its name brand version anymore, it only comes in generic, I would be spending $2,322.17 a month just on prescriptions. Now the prices are a lot lower for the generic versions of these meds, but it's still a lot of money. To get a 1 month supply of the generic versions of all of my medications without having any insurance, it would cost me $1,009.24. Now I don't know about you, but I don't have an extra $1,000 sitting around just for me to pay for my prescriptions. I am so lucky that I have insurance, which makes my meds approximately $75 a month. However, not everybody is as lucky as me. Prescription prices are ridiculous and something needs to be done about them. Thank you guys for making it to the end of this video. If you enjoyed it, please make sure to click that like button and click subscribe so that way you'll be notified of any of my videos in the future. If you have any questions or comments about all of my medications or have a topic you'd like to see me cover in the future, just make sure to leave it on down below for me. I'm Devin, this has been Just a Mental Note, and I'll see you guys next time.